I have already discussed question number 1 and question number 2 of NSEB 2025. The main aim of this session is that every day I will come up with one question of NSEB 2025 in chronological order. In day 1 and day 2, I have covered question number 1 and question number 2. So this is the day 3 for question number 3. You wake up every morning and you see a new question of NSEB every day. So the question says, this is the question number 3. The question says, during wound healing, different cell populations that occupy the wound site as time proceeds. It means that when a wound happens, whatever might be the reason, it might be due to some surgical incision, it might be due to some accident or whatsoever reason. I am not going in the topic of wound healing by first or second intention, or basically in the topic of types of wounds. The question here says as the time proceeds, some cells occupy, and here they have given chronologically which cells comes when during wound healing. Here is the quantity or the unit of wound healing, and there is in the x-axis, the horizontal axis says about the time of healing. So let's see first the core concept behind this question. Whenever there is an wound, I guess it is visible, yes. I will mention it day by day, the events. Firstly, on day 0, the first day when you get a wound or a wound develops. On the day 0, platelets will aggregate in this site, and along with platelets, the injured tissue releases thromboplastin, and that entire mechanism of blood clotting starts. So on the day 0 itself, blood gets clot. This is the first step in any sort of wound healing. In the second step, say I am proceeding one day further. In the day first, on the first day, already blood clot has taken place. On the day 0, we have seen blood has clot. So on day 1, there is already blood clot present. Now what's new on day 1 is that neutrophils will come. On day first, neutrophils take up. As soon as there is a wound, you know from WBC, the neutrophils are actually the line of defense, the primary line of defense among the WBC. Whenever there is a wound, say there is an incision, then at first neutrophil will come. After that, on day 2nd, at the start of day 2nd, you already have clot, you already have neutrophil. Now we will see something new. Other than neutrophil, you will see a thin epithelial layer is formed. Now what is a thin epithelial layer? A thin epithelial layer is the one which you peel off after first day or second day. You see a thin epithelial layer is formed, which we human by intention we pull that off. This is the thin epithelial layer that is formed during the second day. Now we proceed another day further. On the day 3rd, we have all of this, and I am writing what's extra in day 3. In day 3, you will see two things. Firstly, the macrophages will come. Now, what are macrophages? You can simply give an oblique and write monocyte. I am not going into the exact difference, but we can say that in the tissue level, we call this large size cells macrophage, having a large nucleus, or in the bloodstream, we call them monocyte, but there is some slight difference. I am not going into detail. So as of now, we have seen at first, the platelet comes and blood clots. At second, the new cells that came are neutrophils. On the day 2nd, a thin epithelial layer is formed. On day 3rd, you have monocyte. After that, on the day 3rd, another thing occurs. This is the most important event, formation of granulation tissue. Formation of the granulation tissue. Now, what is a granulation tissue? As soon as there is an wound and the wound is healing, see the skin is healing now, the cells here are healing now. But for these cells to be alive, they need nutrients. They need oxygen for respiration. So these nutrients, this oxygen, they are transported by blood. So new blood vessels will form. We call them neovascularization. Neo means new, vascularization means formation of blood vessels. So either you can call that formation of granulation tissue, or you can use a word neovascularization, which in other way you can say is similar to something called angiogenesis. You can use this word here, angiogenesis, which also means formation of blood vessels, but also there is some slight difference for which I am not using this word. Remember here that word neo means new, vascularization means blood vessels. That is, new blood vessels will develop at or around day 3rd. Now, if we move beyond day 3rd, we will see something on day 4th. I'm adding another page. After day 3rd, if we move into day 4th, or you can write day 5th. In day 4th or day 5th, you will see something here called, that event is called collagen bridging. That is, now what is this collagen bridging? There are some fibroblast. You know, fibroblast means fiber forming cells. Fibro means, fibro means fiber. Fiber here refers to collagen fiber, and blast means forming cells. So some forming collagen fiber forming cells will come, and after a certain point you will see collagen is formed. But initially the collagen that is formed is collagen type 3. Initially the collagen that is formed is collagen type 3. Now this collagen is a bit softer. It is not as hard as we see. But by the end of that month, that is around say day 21, after 3 weeks, say I have developed an wound due to some injury, and 3 weeks from today, this are replaced by this type 1 collagen is replaced, type 3 collagen is replaced by type 1 collagen. So if I look into, and type 1 collagen is hard. Now see, when there is migration, let me recall it once again. At first there is platelet. Platelet does the blood clotting. Secondly, there is neutrophil. Third, there will be thin epithelial layer that is formed. At fourth, there are 2 stages. Macrophages or monocyte comes here, and similarly the granulation tissue forms. The fifth event is collagen bridging, where fibroblast give rise to collagen fibers, right? And these fibers are type 3. These fibers, I can say, are a bit softer fibers. And for hard fibers, we have to wait for 3 weeks and you get type 1 collagen. So these are these events. You can write that after step number, we have wrote there event number 4. After event number 4, you will write event number 5, where fibroblast give rise to type 3 collagen, and type 3 changes into type 1 by the end of 3 weeks. Now let's see the option. At first it says, let me zoom into the question. At first it says, the first thing, in the first option if I see, they gave monocytes earlier. After monocytes, they put here neutrophil. So this option is easily discarded, because neutrophil comes far before monocyte. Actually, neutrophil causes acute inflammation, and after monocyte comes in this side, there is chronic inflammation. So monocyte must be must be after neutrophil. But in first option, it is given before neutrophil, so we can discard option 1. In second option, again you see monocyte is given before neutrophil, so we will discard this second option as well. In the third option, it's given neutrophil followed by monocyte, although there are some stages in between. After that, fibroblast that give rise to collagen fiber. This option seems to be correct, option C. But still, I will go for option D to check whether, although I am getting that option C is correct, I will still check option D. They said fibroblast develop first followed by neutrophil. This is again incorrect, because fibroblast will give rise to fiber, so option D can be discarded. Now, what if you are a student and you don't know very detailing about this neutrophil thing or that say monocyte thing? You can simply do this question. The answer is option C. You can simply solve this question by something called common sense. There is fibroblast written here, see. In this option, fibroblast is written. And we know fibroblast will give rise to fiber, and fiber means collagen fiber. There is only one option where right after fibroblast collagen comes. See, in this option between fibroblast and collagen, there is neutrophil. You can discard option A. I am telling this from student's point of view. Then in this option, fibroblast comes at the end, and before fibroblast they gave collagen. Not possible. Where the collagen came from if fibroblast was not there. In third option, you can see collagen right after fibroblast. And again in the last option, they gave fibroblast first, and after that they gave neutrophil, monocyte, and then collagen. So we can also discard that. So if I go from an expert point of view, if you are a biology expert, you can just know this by that day-wise events during wound healing. In the day 0, you get platelet and blood clot. In the first day, you get neutrophil. Followed by neutrophil, you get a thin epithelial layer. After that, you get macrophage and granulation tissue. After that, on day 4th and day 5th, you get fibroblast, which develops into type 3 collagen, and then type 3 develops into type 1st collagen. Right? So this was the day or day by day event of blood clotting. But if you rightly look into this, here we can get this event sequentially, although some names here are missing. That thin epithelial cells, this name is missing. Then that granulation tissue is missing. They have also forgot to mention that type 3 and type 1 collagen. I mean, that is intentional because collagen is at the last. So if there was, the question was asking for which collagen is formed first, then it would have been type 3 first, soft collagen, and then type 1, that is the hard collagen. But if you are a student, you can still answer it by seeing the fact that fibroblast, that is fiber forming cells, the fiber forming cells must come before fiber. So the correct option for this question would be option C, and this one is the answer. I hope this video was helpful. Follow this channel for upcoming videos. On day 4th, we will come with the 4th question of this set, and keep following them. This will help you to clear your INBO exam if you have already qualified, or even if you have not qualified. These are those concepts that are essential from the NEET exam point of view as well. Thank you.